We'll begin this hour with some health-related issues. Well, cardiovascular disease is the leading cause of death globally. In countries like Nigeria, hypertension is prevalent and not well managed. According to the World Health Organization, cardiovascular disease are the leading cause of death globally. An estimated 17.9 million people died of cardiovascular diseases in 2019, representing 32% of all global deaths. Of these deaths, 85% are due to heart attack and stroke, while over three-quarters of CVDs, as they are called, it takes place in low and middle income countries. Out of the 17 million premature deaths due to non-communicable diseases in 2019, 38% were caused by cardiovascular diseases. It is important to detect cardiovascular diseases as early as possible so that management with counseling and medicines can begin. Well, for more on this, let's now cross live to London, where we can speak to Dr. Joyce Omatsheye. She is ready to really speak with us. Dr. Omatsheye, I have been looking forward to this conversation here on Newsnight. Thank you for being here. And let's talk about this. How common is hypertension globally, and what exactly really is hypertension?
Your heart actually helps to pump blood around the body. And when you have a high amount of pressure pumping around the body, it makes your heart actually work way harder, which can lead to problems with your heart. But actually, not only that, can lead to problems with other organs. And so that's why we're talking about it today. As you said earlier, cardiovascular disease is a world burden, not just in lower and middle income countries. So we have about 1 billion people across the world that have been diagnosed with high blood pressure. Now, that's 1 in 5 women and 1 in 4 men. So it's very, very prevalent. And the burden of disease is actually growing not only in developed countries, but in developing countries and lower and middle income countries like Nigeria. And that's predominantly down to the incidences of the risk factors that actually lead to high blood pressure. So it's extremely important that we speak about hypertension today.
Right. Well, you know what? Let's have this conversation. I want to actually localize it and bring it back home here to Nigeria, because if you look at the data, it says nearly a third of Nigerians experience high blood pressure. And we've seen that number really grow in the last couple of years. But some of them might not even know the risk factors that lead to blood pressure. So as the expert tonight, can you tell us about what really leads to high blood pressure?
Yes. So with high blood pressure, again, there are many different risk factors. And how I like to think about it, because I think when you start mentioning a lot of them, it may be a bit confusing. You can think about it as modifiable risk factors. So these are factors that we can change, and non-modifiable risk factors. So I will start with non-modifiable. These are things that we can't change. So these are down to our genetics. If you have a family history of high blood pressure, it's likely you may have. The older you get, the more likely you may have high blood pressure. And if you have pre-existing conditions such as diabetes or kidney damage, you're more likely to have high blood pressure, increase your risk of getting it. Now, non-modifiable, these are factors that we can actually change. And these are probably one of the most important things that we talk about today. So non-modifiable are things like your diet. We cook with a lot of salt and fatty foods. So unhealthy diets can increase your chances of high blood pressure. Being overweight and obesity has a high effect on whether you get high blood pressure or not. And also whether you smoke, the amount of smoking and alcohol intake. So these are risk factors that can increase your chances of high blood pressure. So it's important we look at both non-modifiable and modifiable, the things that we can actually change.
I like the fact that you've gone about, the things that we can change and things that we cannot really change. Because I'm looking at this data right now where it says, we're seeing more and more young people susceptible to high blood pressure. Before growing up, they will tell you high blood pressure is a disease of the old people, but these days more young people are coming down with it. So what are some of the symptoms that we should be aware of that should get us to, step up as it concerns taking care of our health?
So the thing about high blood pressure, and I think if you speak to anyone, sometimes they call it the silent killer, because most times you're asymptomatic, which means you may actually not show any symptoms. Okay, most times when it's more malignant, people may get headaches and dizziness or irregular heartbeats and things, but most times you may not show symptoms. So this is why we're coming back to saying we need to actually go and get your blood pressure checked regularly. So you need to know what your normal blood pressure is, and also check that every year or so when you're having your full checkups, just to see how it's doing. And then we can make changes to make sure that it's not going higher than it should and is being maintained. But a lot of times, symptoms you may actually not get.
So who should be checking? You talked about going to go get that regular checks, but from what age should we really be checking? Especially, you have to break it down for us for those who have that underlying illnesses or have a family history, and those who are just regular. What age should we go check for high blood pressure? And let's talk about some of the complications, really.
In terms of age, it's really hard to say exactly what age you should start. I think once you become an adult from 18 or so, you should definitely know what your blood pressure is. The more you have pre-existing, if you have pre-existing conditions such as kidney problems or diabetes, it's important that you get that checked even more regularly. So as soon as you get diagnosed with that. So I would say once you turn about 18 to 20, 25, you get checked, but definitely from when you start turning to 35, 40, 50, you should be getting your blood pressure checked regularly. And this can be in a hospital setting and with your primary care practitioner, but it can also be at home. And I think that's one thing people don't know. You can buy your blood pressure machine at home after your initial checks and also monitor it every month or so. As you said, there are definitely complications of blood pressure. And I think a lot of people don't know the damage that high blood pressure can have on the body. As you said earlier, it can increase your chances of stroke. It can reduce the amount of oxygen and nutrients actually going to the brain. And so you have increased chances of stroke, heart attacks, kidney damage, which can actually lead to kidney failure. And it can also affect your eyes and cause blindness. So there's a lot the high blood pressure can have on the body. There's a higher risk. By having high blood pressure, you have a higher risk of getting other conditions. And so that's why we want to regularly monitor it and treat it when detected.
Treating when detected is important, but Dr. Omatsheye, I have to go in this because we're seeing more and more young people really become alcoholics, if you want to put that word out there.
Yeah.
We're seeing more and more young people really take to the bottle or even drugs. Some of them might not be aware that they have it. So what are some of those risk factors for young people? Make them understand as to why moderation is key in most of this, vices, as we like to call them, and how can we manage high blood pressure, no matter who you are, very quickly, as we wrap this up.
Yes. So for my younger generation, or for anyone in general, I think, especially with what's happened with the pandemic, a lot of people have started drinking alcohol more, increase their drug intake. It's important to know that having excess of anything can be a problem, especially when it comes to alcohol. So no one is saying you don't have any, but it's good to do things in moderation. And as well as talking about alcohol, diet is a very big deal. And this affects anybody, no matter what your age is, whether you're a child or an adult. We need to be keeping healthy diets and really be controlling those things that we can control, be managing the risk factors that we have control over. In terms of management in general, lots of times when people have blood pressure, we don't necessarily give medications immediately. We may actually monitor you and actually allow you to make these lifestyle changes. And if then we are not able to manage your blood pressure with lifestyle changes, then we can actually give medications and antihypertensive, so high blood pressure medications that can help to reduce that blood pressure. But again, if you are prescribed with these medications, you need to take them regularly. You need to go for your regular checks. You need to ask questions. And if you're not sure of anything, that's why your doctors are there. And I think a lot of people, what happens is that they do know that they have high blood pressure, have this family history, but they're not sure where to go. But speaking to your doctor and getting further education through this and through your doctors is extremely important.
Extremely important to also take a lot of water. Sometimes swap the alcohol for the water and the salt. Reduce some of it. Dr. Omatsheye, thank you so much. She is live in London for us. Of course, she is our doctor to keep us healthy. Thank you.